If we're going to have successful health reform, a great deal must change at the patient, physician, and patient caregiver level. We're talking about patients who won't have to wait to be seen. If you're really sick today, you get seen today. If you are in the hospital, you don't have to worry about getting an infection that is possibly worse than whatever brought you to the hospital. And you want to have caregivers who will attend to your needs based on your situation, not their needs and their preferences. These are the kinds of changes that are happening in some places around the country, but those are things that are not happening because anybody is promoting reform. In fact, they're happening in spite of some of the dysfunctional payment systems we have and some of the arrangements that are currently prevalent in the healthcare system. The kinds of provisions of reform proposals that are currently being considered are really geared to giving people health insurance, making sure people have access to care. But the concern about what kind of care they're going to get is not as evident. And it is a much more difficult and much more long-term effort to change how healthcare is delivered so that people get the care they need when they need it, the way they would prefer to have it, and to have safe care. And all of that actually would result in more efficient care. We're talking about a major change in the culture of the medical care field, where the patient is put first. We're talking about altering the way we think about caregiving altogether. Imagine physicians' offices that have only 2 chairs because there's no waiting. If we take the current administration at its own word that they want to have care that is safe and that is high quality, if we don't address the issues that are at the patient level, we will not really have had true reform. We will have simply increased the number of people who have access to a system that by all measures is not as good as it could be.